Hello, my name is Upasana Sharma and my student ID is 163712235, and today I'm going to be performing my dressing video, but before that my friend will take a 360-degree scan of the room. Thank you. Good morning, sir. My name is Upasana Sharma and I'm a registered nurse over here for you today. The doctor have prescribed a dressing change for you from the old one, replacing it with a new one. So today I'm going to be performing it on you. So I hope it is okay for you.
Yeah.
Okay. Thank you for the consent. Next, I'm going to ask your name and your date of birth.
Okay, my name is Pavan Singh and my date of birth is 20th July 2000.
Okay, thank you, sir. May I have your head? Okay. So it matches with my documents. Thank you so much. So before I start with the procedure, I have few questions for you. The very first thing, do you have any kind of a pain? And if yes, let me know. Can you scale it from the scale of 0 to 10?
I have no pain, so I will rate it 0.
Okay, so my patient has no pain, so I'll consider it to be 0. And if I'm going to be performing the procedure, is it okay if you're comfortable with this, or you want any head?
I'm
Comfortable. And in case of allergies and medicines, are you on any kind of an allergy that you have, or medicine that you're on?
No.
No allergies, no medicine?
No.
You're not taking any medicines. Okay. So next I'm going to be removing the dressing, the old dressing, and inspecting that. Okay, before I start with the removal of the old dressing, two major things is that the privacy has been provided for the patient, and I'm going to do my hand hygiene. So I have performed my hand hygiene, and I'm going to wear my gloves. I'm going to wear clean gloves, and I'm going to inspect the wound. I'm going to remove the dressing, so if you have any uncomfortability, let me know. So before going to the wound, I'll check the old wound. So the old dressing has a serosinus drainage, which is normal in a healing wound, and it doesn't have any clot or active bleeding. So that's what we inspected. Coming over to the wound on the patient, so on inspection we are able to see that there is slight erythema are at the site of sutures, which is very normal. Approximation is very fine, and even there is no edema or any kind of active bleeding. On palpation, do you have any pain?
No.
So patient even doesn't have any kind of a discomfort or pain, so we can go ahead with the dressing. I'm going to sanitize my gloves, and I'm going to open my dressing tray. So I'm going to open from the outer aspect only, from one side, two side, three, and I'm going to just touch the very corner, and I'm going to take. So it's sterile. I'm going to put it here, and I'm going to manipulate my tray. I'm going to straighten it up according to my comfortability. I don't want this. I'll check around. So I have 3 to 6 gauze pieces, which is what I need. So I don't really need anything extra other than a tulip, which is for my approximation. So now I'm going to use this, again touching it within the sterile field, putting it inside the sterile field. I'm going to approximate it, putting this over here, measuring till the last end of the wound, taking it, measuring it. I'm going to throw this. It came out to be 7 centimeters. Now I'm going to sanitize my hand. I'm going to put some normal saline, and I'm going to remove these gloves, and I'm going to put a new pair of clean gloves again. And I'm going to start with my dressing procedure. So I'm going to be starting with my dressing procedure now. So with the help of sterile, I'm going to take 1. I'm going to be taking 2. I'm going to again putting it here. So yes, So now I'm going to take putting it in the NS, excess remove, one stroke, farthest, one, done. Nearest, two. In the middle, three. Now I'm going to put the dry ones. Farthest, one. Nearest, one stroke again, two. And the last one for the middle one. Six. So now I'm going to put the dressing over so for the change. As my dressing doesn't need two flaps, so I'm not going to use anything else. I'm going to remove my gloves. I'm going to put one, two, three, four, and the last it contains the date and the time on when I change the dressing. I'm going to remove the things. I hope you're comfortable, sir.
Yeah.
Okay. So as my patient is comfortable and I've done the sterile procedure of dressing change, my mate will take a 360-degree room of the scan. Thank you. I've also performed my hand hygiene at the end, and thank you, and the patient is comfortable.